Autobio colloidal gold keys contain 5 components: test cassette, sampling swab, sampling tube, dripper, and extraction reagent or sample diluent. Serological rapid tests can be applied to serum, plasma, heparin, EDTA, or sodium citrate and whole blood specimens. Before blood collection, remove the aluminum foil pouch and place the cassette on a clean, flat, and dry surface. Collect samples in accordance with correct medical practices and then add appropriate volume into small sample well. Add approximately 2 to 3 drops of the sample diluent into each large sample well. Rate the test results between 15 and 20 minutes. Nasopharyngeal swabs are directly performed on etiological rapid tests. Firstly, add appropriate volume of extraction reagent into the sampling tube. Collect nasopharyngeal swabs and then fully soak the swabs into the extraction reagent. Squeeze the swab from outside at least 5 times. Add approximate 2 to 3 drops of the sample solution into the sample well. Read the test results between 15 and 20 minutes. The results of Autobio rapid tests are easy to read without special training. A visual T line indicates a positive result, and the C line is applied as a control for the righteousness of measurement procedure. There are 3 possible results: positive, negative, and invalid. Positive means the patient has corresponding antibody or pathogens in the body. Negative means the suspected case is possibly not affected, but a solo detection cannot prelude the infectious possibility without test CT, NAAT, or other clinical diagnosis result. If the result is invalid, a retest is recommended immediately. Autobio, your reliable partner in diagnostics, provides fast and effective diagnostic solutions to SARS CoV-2. Fight against the pandemic and protect your health.